For months, News 4 has kept close tabs on the state's public health lab. Everything from concerns about newborn screenings to questions over COVID variant testing. And more than a month after asking to tour that facility, today News 4 was finally granted access inside. News 4's Ashley Moss reports.
We've been consistently reporting about issues with newborn testing screenings here across the state. We traveled here to the public health lab today to get some of those questions answered. Leadership telling us today those abnormalities are all a part of the process. Before the tour started, News 4 was told no cameras would be allowed for the first part of the tour, staff citing privacy concerns. One of the issues that brought us here, problems with newborn screenings, leaving some Oklahoma parents on edge recently.
They've had unusually high numbers from one month to the next. What's the explanation for that we can take back to parents?
So, first of all, we do have new equipment. We've relocated our lab and we've got new state-of-the-art equipment. So anytime you have different equipment, you might have different sensitivities within that equipment.
So the issues are with equipment?
Now, I'm not saying that the issues are with equipment. I'm saying the equipment is different equipment than what we've used in the past. So when you change equipment and do that like what we've done here, changing that equipment, then you may see a change in your abnormal results. Nothing that we're going to do is going to eliminate abnormal results that ultimately end up not being positive.
In December 2021 alone, 72 tests came back positive for XALD, a potentially fatal and rare genetic disorder. All of those tests conducted at the state's health lab. However, data from a 2015 study done at Duke University indicates there should be 2 to 3 positive tests for every 100,000 tests done for the disease. Remember, there are Oklahoma parents who were incorrectly told their baby had received a positive screening for a life-altering condition.
And we understand, again, that is, it brings on fear, it brings on uncertainty, and I wish that were not the case. But being a screening program, unfortunately, there's always going to be some of that that's going to have to occur, or else we're going to miss positive cases, and that's just a risk that we can't take.
The commissioner also saying they're working with lab partners and manufacturers to explain why those numbers were so high.
We'll continue to do that to get it down to the absolute minimum that is acceptable.
We also wanted to know about the lab's COVID-19 testing ability. According to the CDC, Oklahoma ranks near the bottom for variant testing.
Well, we're not 50 out of 50 anymore. If you look at the total numbers done, it's somewhere in that 30 to 40 range is where we're at now. So we made significant progress on that. We had some difficulties early on trying to get the data upload.
State leaders cut the ribbon on this $30 million health lab in January of 2021. At the time, it was considered state-of-the-art and was described as a front line of defense against COVID. When asked today about it, Reed said while there is a brick-and-mortar building for the public health lab, the much-touted pandemic center is more of a vision.
But the pandemic center itself, sounding like it is a physical structure and an operational building, that does not exist at this point. The pandemic center itself is a vision. It can be part of this building, but currently I can't tour you through the pandemic center because there's not the pandemic center.
As for that $30 million, Reed said it was used for the state's COVID response and testing. But Reed says there is a goal in place.
It's in planning. It's part of partnership development.
In Stillwater, Ashley Moss, Oklahoma's News 4.
The public health lab now has a permanent director. She was along for today's tour, but we did not receive clearance to do a one-on-one interview with her.